Hi, my name is Vikas Kodagal. I'm a neurologist here at the University of Michigan. I'm also the principal investigator for the ongoing Citalopram in Parkinson's disease study. I want to thank you for visiting our website, and in the next couple of minutes I'll try to explain a little bit about the scientific rationale behind our study and a few details about what's involved in study participation. As you may know, Parkinson's disease, or as I'll call it PD, is a common condition that affects about 1 million Americans. About 50 to 80% of people with PD will go on to develop dementia typically over a number of years following their initial diagnosis. Currently, there are no known treatments that prevent dementia in PD or reduce dementia risk. Our study is aiming to address this important knowledge gap. This is a gap that matters to Parkinson's disease researchers, but it really matters to people living with Parkinson's disease and their families. Based on some promising preliminary data, we're aiming to test the hypothesis about whether a certain class of well-known antidepressant drugs might reduce the risk for developing visuospatial cognitive problems in Parkinson's disease. These problems can often manifest with difficulty navigating in space, like bumping into doorways, and sometimes with things like visual hallucinations. This study is taking place only here at the University of Michigan, where we're hoping to enroll 58 people with Parkinson's disease who don't have dementia and who are not taking certain classes of antidepressant medications. You can look at the Do I Qualify section of the website for more information about whether or not you're eligible. In this study, participants with Parkinson's disease will have a 50-50 chance of receiving either a placebo or a sugar pill, or the study drug Citalopram, which is an FDA-approved antidepressant, but is not FDA-approved for the purposes of dementia prevention, which is what we're testing it for in this particular study. The overall study involves about 12 study visits over about a 28-month period. 3 of these visits are more involved and involve a full day of clinical testing, so that involves Parkinson's motor testing and thinking and memory testing, and a separate full day of imaging testing. These more involved visits happen about every 12 to 18 months, so 3 times during the study enrollment period. Participants are also given a small stipend to cover the cost of travel, and study-related procedures, including the drug and imaging tests, are covered by the study budget. The study team and the participant are blinded to which arm they're randomized to. What that means is that neither the study coordinators or myself will know whether you're receiving the placebo pill or the active drug, nor will enrolled subjects. I also want to note that citalopram is actually a clinically available drug. We're not advocating that people take this drug for dementia prevention purposes, but it is a common medication that your regular doctor may be able to prescribe. The reason to participate in this trial isn't necessarily to get a drug. It's to be part of something bigger than that. If the study's hypotheses are ultimately confirmed, these results would dramatically change Parkinson's disease care and could be helpful to tens of thousands of people with Parkinson's disease in the future. If you're interested in hearing more about our trial, please look for our contact information on the website. Our study team would be thrilled to set up either a phone meeting with you or a video meeting to talk further about what's involved. Thanks for taking the time to watch this video and visit our website. It shows that you're thinking about Parkinson's disease research, and I'd be thrilled to get to meet you to discuss your interests further in person. Thank you again.